make sure use a body wire and use based on the IVUS, I use the 2.25 non-compliant balloon to prepare the distal LD. Yeah, it's smoothly. Okay.
What size balloon in this?
2.25.
Excellent.
Yeah.
High pressure.
Yeah, yes. Non-compliant balloon. 12 years. Okay. Here. 12. 14.
14.
Yeah. Picture. Yeah, great. Okay. Up. 14.
14.
Okay. Down. Here something. 8.
8.
Okay, good. Down. Here. Okay. 14, 12, 14.
14.
16.
It's very nice also
16.
for me to appreciate your team. You know, whenever we are watching live cases from Nanjing First Hospital, we always realize how efficiently they work. 16.
Okay. Okay. Oh.
16.
Okay. I want to use another notch non-compliant to prepare this middle LD. Here is some of the resistance. So 2.5 non-compliant balloon.
I think to get additional support with the body wire was a good idea.
Yeah,
I always
yes.
think it is a better approach than going with the mother and child catheter approaches. Less prone to have complications and hopefully will do the job.
Yes, thank you. Here is 2.5 non-compliant balloon is smoothly. Okay. 14. Okay.
14.
The balloon expanded very well here. Yeah. Okay. Okay. 14, 15.
16. So our global audiences are always asking us on both the Medstream website forum as well as on YouTube about
16.
I'm assuming that the majority of the equipment which is being used in the cases is all Chinese.
Okay.
These balloons, guiding catheters, stents. 16.
Okay. Okay, for the distal movement, because the large vessel, I want to use the 3O, the non-compliant.
Okay. But you did not dilate that segment with the 2.5. You want to go directly with the larger.
Yeah, here I want to the test to. Okay.
Looking good. Looking good.
Okay. So, yeah, see, yes. Okay.
So for almost all the coronary cases in China, the default approach is a transradial.
Yes. Probably it's 90%.
Yes, that's what I've been hearing.
Yeah.
Our numbers in the United States are nowhere there, but the numbers are increasing.
Oh yeah. Okay. Yeah. This is slow. Non-compliant balloon. Okay. Oh yeah, good.
They expanded very nicely and easily.
Yeah. Okay. Here is a distal mat. Okay. Yeah, good.
And expanded very well there too.
Yeah. So. Okay. I want to check. Yeah, easy, smoothly. So give some the nitro. I want to check IVUS again. I was super ready. Open.
Ready.
Okay. Give some nitro. Okay. Huge. Good.
Go.
Is a picture. Here we check the
This
yeah.
left main and the LED looks all right. Don't think there has been much of a plaque shift into the circumflex.
Yes. So probably some of the coordinate shift to the second diagonal. Probably use another wire
yes.
to protect this
Yeah.
diagonal.
The fairly large diagonal.
Yeah, before the standing.
Right.
Okay. Come. Okay.
Okay.
So it's permanent. Oh, here is a very curve. Seems like not easy to cross. This oh, cannot cross.
Yeah.
Yeah. So it's the middle LD is very torturous. So I don't want to. Hey, use another 2.5 common balloon.
So that was a little surprising there, considering how well the previous balloon had expanded there.
Yeah. So
this is the
yeah,
same
the middle
2.5,
LED. That's
just before the second diagonal, between the first and the second diagonals.
Yes.
So in what percentage of complex cases are you using imaging? Almost all of them?
Yeah. For the complex, all use the intravascular imaging to guidance OCT or the IVUS. Okay. Here.
Sure.
Yeah. Seems like the balloon expanding is good.
Yeah, very well expanded.
It's just, I think it's just because the tortuous vessel. So here.
Sure.
Yeah. Here.
Should be much easier now.
12, 14. Yeah, 16.
16.
Here, okay. Here, yes. Probably okay, it's good. Okay, here.
8.
Okay.
Okay.
You see? It's very
well expanded.
Yeah. Okay. Okay, I want to try again. IVUS caster. Sorry.
And this is a 7 French system you're using?
Yeah, it's the same French. Yes. It's okay. The flash.
Which IVUS system is this?
This Boston Scientific.
Excellent.
Yeah. Yeah, I want to. It's easier than before.
Goes
yeah,
much well, a little bit.
So I've tried to engage and then to probably
all the tortuosity.
Yeah, but the thing is, casting is soft. It's not cross. Probably. Always sorry. So remote. So
not tracking, and
yeah,
I think you need to make a decision independent of that.
Yeah, I want to also check the
Let's maybe have another angiogram and then try to make a
Yeah, it's
very nicely.
very nice.
the
I think
non-
probably we
non-
can use try the standing. Or is okay.
2.59.
Before that, I move this Y into the diagonal. Okay. Yeah, also it's not easy. I think here you have. No.
All right.
Okay, so
Very good job with the.
here,
I probably need to go into the.
here.
you-
Okay.
Yeah, you're in the right
Let's
place.
stand. Okay. Still here.
So as you put in, you're planning to put in a.
Yeah,
a
stand. 2.5 stand.
Okay.
Based on the IVUS is
Got that was a rough size approximately. Okay.
yeah.
Can I, as you do that, I want to bring to our viewers, the Medstream global audience, about some questions I think they will have regarding Medstream, its impact in your hospital in China, and also I have wanted to discuss about some of the progress and the developments of
Yes.
interventional cardiology in China, some of your
2 to 3.
training programs, and
Aren't you? Yeah, stand crosses smoothly.
yes, easily.
So,
Yeah.
or
It was surprising why the IVUS
Charitable.
catheter is not.
charitable.
no. So, yeah, I believe based on the IVUS properties here is the
Maybe a
plaque
little,
burden is
right.
less than 15%. So I want to
avoid that.
is a good position.
Yeah,
Yeah.
looks good enough.
Yeah.
Maybe,
So
maybe.
okay.
8,
9.
9.
Good.
So how do patients perceive it when you talk to them that their case is going to be reviewed live and watched by a global audience? Are they concerned? Are they happy about it? Or
Yeah. Also happy.
yes,
Yes. We all talk about the before the
right,
yeah,
before
yeah.
the procedure.
Yes. Yeah.
10.
Yeah. Great.
And it is also our belief that once you have a live demonstration
Yeah.
cases, it also even improves the outcomes.
Okay.
Patients get more academic treatment. The interactive discussion also helps, and
Yeah. To help the patient. Yeah. I think. Okay. Understand? 2.75.
25. 40.
40?
어,
33?
33.
Yeah, and I want to do a picture.
yeah, let's see how it
we
looks.
have it,
It
and
looks very good.
good. What is it? It's, what here is a dissection. Move the photo view. I want to see. What is it? Okay. Good.
Okay.
Okay.
Well, the circumflex is looking just fine.
Yeah, yeah, I think so.
The one in the AV groove, of course, there is a tight lesion there at that angulation, but at least the ostium is just fine.
Yeah, also is fine. Its surface is small, and the OM probably is a bigger one than one.
Right.
Okay, it's yeah.
So what's happening with the Medstream? Do you think most of the interventional cardiologists in China know about the program?
Yeah, because we all did this knife case and 8 weeks.
Yes.
Yeah,
Week
so
8 today.
yeah, they were all lot of Chinese interventionists.
Still a very short
Yeah,
period of time.
yeah, here no.
Sure. Yes, I will ask them. Yes, yes. We also have, I'm going to read
Okay,
some online
no.
questions. What are some of the complications of the procedure? I'm sure they are thinking about abrupt
okay.
occlusion and
Sorry.
inability. I think much more than complications of the procedure, the concern would be that
没有，这上面
you need to
我那
have
边有
good
通才角，通
ablation
才
so
角
that the
那个
stent
点
expansion is okay.
点了。
I
Yeah,
believe
okay.
that is the question being asked. Another question is, considering the patient's previous stent in the RCA, are there any I'll report on
Feel free
that.
to
to know these things. You know, there is a
Oh,
very large
that's,
global appetite for
yeah,
learning about the new technology. Who makes
yeah,
this?
this is a portable balloon.
Yes.
Yes,
Which company manufactures it?
it's a domestic Chinese company.
Excellent.
Yes, it's a very short, a very short shot.
About
It is-
6 millimeter.
Yeah, 6 millimeter.
Yes.
Yes.
Excellent. So
To do the port for the bifurcation
So
is great.
Dr. Shaolin Chen is not only famous, as I used to know him for his pulmonary arterial
Okay.
denervation, which I think he mentioned today were a series of meetings talking about its further regulatory passage. My congratulations to him. And of course, now I come to know that he also has a dedicated pot balloon. I think there is a need for it. Something very precise and
Good.
looks all right.
Yeah, so I want to check IVUS finally.
Okay, so that was the question which somebody has asked. We'll give you the answer
Okay, thank you.
with IVUS. So what is the average? How much is the volume of PCI in China at the moment? Is it already the world's biggest or catching up soon? I think.
You mean my center?
No,
or the Chinese?
for the country.
Well, country, 1 million.
Yeah, that's what I thought. Yeah,
Yeah, more than 1 million. Yeah.
more than a million. So
Yes.
you know, I'm sure that the world's biggest PCI use is going to be in China and India, and just the epidemic of coronary artery disease. I'm sure that even in China, you're seeing more and more diffuse disease in younger and younger patients.
Yes.
All right. So the IVUS catheter, which previously could not even cross, is now into the mid to distal segment, and we'll get an excellent imaging.
I want to check
we'll find a good stent expansion.
Yeah, I just check IVUS from here. Okay.
Okay. Let's
Open
do
it.
it.
Yeah.
From here, I will pull back.
Yeah.
Yeah, this is distal LED. In sand diameter about 2.75.
Very good so far.
Yeah.
I'm sure you're happy with the result, and the expansion is good.
Yeah.
It's
a diagonal?
Maybe
Second diagonal?
The second diagonal. Yeah.
Yeah.
This is in middle LED. The stand diameter is more than 3.0.
Okay. So which is where you were tapering down and taking it to 3.5.
Yeah. The normal diameter almost 3 millimeter.
That place, you wonder if there's a little more further post balloon dilatation, but looks all right. I think.
Yes, yeah.
This is the first diagonal.
Yeah, this is the first diagonal.
So here is the proximal LED.
And how much is the volume of structural heart at your institution? I'm sure it's to get a national number is very tricky because those numbers keep changing. But you're doing more and more, I'm sure, structural every month.
Yeah, we do every month structure, but structure is hard. Intervention is in China is probably delayed for the European or USA.
Sure.
So probably is
cost.
So the several source per source the cases will be done in China.
Excellent. So how many interventional fellows do you have training with you every year?
Our center probably is 20.
Excellent.
20, yeah.
A very large training program.
Yeah.
So do your fellows tell you are they finding MedStream 360 useful for their training?
Yeah. Yeah.
Very good. I hope to meet with some of them, get their thoughts. We are always trying to learn how to address their special educational needs.
Here is the man.
Yeah, left man. The proximal stand edge is normal, no dissection. Okay, I will
Okay.
stop.
Because the ostium and the man is so okay.
Yeah.
Stand is not covered. Okay. Okay.
In the meantime, as I normally do when I'm watching the cases at Miami, always from the corner of your eye, you're looking at the time. How are we doing with the time for this case? How much time do we have? What is the time now? What is the... So somewhere around this time, this is how MedStream 360 works, and this is what what I take care of being located remotely in Miami. We try to move. I think this particular case, things are looking very good here. I'd like to thank the team in this case. Excellent demonstration. I think if I would summarize this case, what are the teaching parts? I think primarily was the very good decision which was made initially to use just as a standby intra-aortic balloon pump. I think the decision was very good clinically that the patient would do quite well without it. The thought process, imaging guiding, how with the high pressure balloon, most of the vessel was prepped. The decision to not address the left circumflex, all those excellent choices. I want to congratulate this particular team. I'll move to the next room now. And once again, a pleasure to meet you and with your team. Any final comments by you? You're happy with what you're seeing so far?
Yeah, I'm very happy with this final result. I want to say it's imaging guidance is very important for this case. They just use a non-compliant to prepare this lesion is enough for the standing all the non-lesions.
Absolutely agree. Outstanding results, as I'm sure our viewers can see. Stenting across the left circumflex, excellent result. IVUS proven, guided, leaving the left circumflex alone, which looks all right. So we'll move now to the next room, and thank you so much all. A pleasure meeting you. You're doing a great service for MedStream 360.
Yeah, thank you.
Thank you.
Thank you.